The graphs you sent at the end and the artificial intelligence modelling on the effects of the quarantine is so interesting. It's wonderful data. Because I think there were a lot of question marks at the beginning when the Wuhan was shut down, whether this was a good thing to do, but it seems clear that it had a very significant impact. Is that how everyone feels?
Oh, yes. I think that definitely is a good procedure. I mean, the government have been taken. I mean, So the expert committee announced there's definitely human-to-human transmission, and also a lot of medical staff being infected. That's a very serious situation. So based on that, I think the third day of the that was I remember that's 23rd. So the central had take the
23rd of January.
Yeah.
Yes, okay.
So the very strong action, the so-called early quarantine, I should say, quarantine by themselves in the whole country, and
yes. Oh, I'm sorry.
It's very important. This isolation, really important step.
Yes.
So the prevalence, the incidence of disease declining very fast. That seems declining very fast. I suppose in other countries should be doing something like that.
They have in Italy. I think it may be difficult in big cities in Europe to achieve anything like was achieved in China. I don't know how possible that will be, but at least we have the information to show us.
I suppose I think that's the only way, because we don't have a very targeting medication available for this kind of new kind of virus. So probably that's the oldest way and the most efficient to prevent them from further spreading.
Yes. Actually, picking up on the medicines, the data on the trials, the chloroquine was very interesting. Those trials are continuing, are they?
Yes. It seems to be. I mean, at that time, so it's impossible to do any control study, because the patients are facing the threatening disease, so they cannot act as a control or placebo. That's inhumane. We can only give some single arm and see what happens later.
Yes.
If the turning negative of the virus load, I suppose chloroquine seems to be working that way. Only 4 days or something like that. So I suppose we may, if possible, probably in some other countries should try to have such a test.
Well, yes. I think because it's relatively cheaper, it's repurposed. That is one of the easier drugs to trial. So that information is very helpful.
So I mean, by that dose, I think the toxic side effect is not that hard. So far we have already done about 200 patients.
Okay. Also, the data and the slides you showed on the sputum within the lungs and the N-acetylcysteine use, that was extremely interesting.
Yes. That's a big problem for us.
Yes.
A big problem. I think I just showed you that's a very sticky mucus. What we have done, of course, we have analyzed Mach 1 and Mach 5.
Yes.
It's a very high concentration as compared with the COPD patient and so on. And then we had found when we give ventilation, that's a big problem. So really different from ARDS. As you know, ARDS only affect the lung parenchyma or interstitial. And then when the PO ratio improved, we can draw gradually of the but actually we cannot do that in this kind of patient, in those patients who had a very strong phenomenon with unsynchronized of the patient and ventilate, indicating that's very difficult to breathe for this patient. Why was that? So it's not so that ARS is less effective small airway. But however, in this kind of patient, the small airway is really effective. So that's why we are trying to do something like using N-acetylcysteine or some others, even some DNAs.
Yes.
So we're trying at the moment because 6 patients on the ECMO at the moment in my ICU.
Yes. And you lavage with the NAC, did you, or just?
I suppose a lavage NAC. I mean, in those patients with ECMO, we're trying. I suppose we need to do this earlier. So earlier, if we predict the patient is getting deteriorated, we should do that earlier. That's most important.
Okay.
I would like to introduce to you, because we just finished some of the data from 3 hospitals. We use the hydrogen and oxygen mix.
Yes.
It seems to be working very well. I am happy about that. So I just got the data right now. So from Wuhan and from Guangzhou, and 3 hospitals, all together 60 something. And after inhaling this hydrogen and oxygen mixed gas, they improved. The dyspnea improved the 2nd day, and the 3rd day, and the 4th day. So all of them showing really improved. I suppose because at least resist early stage, and also have a good turn to hydrogen and oxygen. It's easier for us.
That's fantastic.
Yeah,
yes, I remember using helium as well in patients with upper airway tumors to relieve symptoms. I'm that age too. So you used it because it was cheaper mainly than that was the main reason. Okay, thank you.
We've been using now in nearly 1,000 patients.
Wow, fantastic.
A majority of them show some improvement.
And you're just using it like with the high flow nasal oxygen therapy. You're just in training into spontaneously breathing patients.
Yes, but compare with high concentration oxygen. By this way, hydrogen plus oxygen is much better.
And what percentage hydrogen in the mix? Because I think we're not familiar with using that.
66% of and 34 or 33% of oxygen.
Okay. Thank you very much.